Foramina of the skull base, ethmoid bone, located anteriorly at the base of the skull and surrounded anteriorly and laterally by the frontal bone, contains the cribriform plate, which contains many tiny holes that allow the olfactory fibers from CN1 and the olfactory nerve to pass into the nasal cavity. Tick canal. Sphenoid bone, located posteriorly to the ethmoid and frontal bones, considered an important structure with regard to foramina of the skull, since many reside within this bone. Generally, from anterior to posterior, they include optic canal, contains CN2 and ophthalmic artery. Superior orbital fissure contains CN3 and CN4, CN5-1 and CN6. Note: important since it contains all nerves relevant to eye movements. Foramen rotundum contains CNV2. Foramen ovale contains CNV3, lesser petrosal nerve. Foramen spinosum contains middle meningeal artery. Foramen laxarum contains greater and deep petrosal nerves. The foramina of the skull within sphenoid bone, temporal bone, located roughly in the middle of the base of the skull, between the sphenoid and occipital bones. Internal auditory meters contain CN7 and CN8. Note: in contrast to the external auditory meters, which we know is the auditory canal, since this foramen deal with hearing, it makes sense CN7 is involved. Carotid canal contains the internal carotid artery. Jugular foramen contains CN8, CN10, CN11. Note: when you think of the word jugular, you often think of the neck. The above cranial nerves or have some association with the neck region. INBD pro tip: you can remember the order of the foramina by using the memory during your study of the Ross League. The first two foramen have to do the optic nerve, thus observing. The next three foramina spell Ross, your friend's name. The last one is foramen laxarum, since Ross plays in the hockey league. This foramen alongside the other looks like the backwards arrow or hockey stick. Carotid canal, internal acoustic meters, jugular foramen, the foramina of the skull within the temporal bone. Occipital bone, located posteriorly at the base of the skull. Foramen magnum communicates with the vertebral column, thus containing the spinal cord. Spinal and vertebral arteries, not the Latin name quite literally mean big hole, which describes its appearance. Hypoglossal canal contains CN12, the hypoglossal nerve. Hypoglossal canal, foramen magnum, the foramina of the skull within the occipital bone. Fossa of the skull, external fossa.